This is Linda Unaland. I'd like to extend a warm welcome to Elizabeth Ramirez, who is a trauma specialist. Liz is a certified social worker who has expertise in the field, and I'd like to invite her to share her experiences with us. Liz, please tell us a little bit about your background.
Thank you. Thank you so much, Linda. So I started with social work in 2016. I graduated from NYU School of Social Work, and then I started the trauma background more so about a couple of years ago, where I noticed like a lot of my clients had trauma concerns that were left unaddressed.
I imagine that trauma, if you think about it, is something that affects everyone. It's impossible, I think, to have a life without trauma, big and small. Some people certainly get more than their share. And I know when I do some of the psychosocial histories on some of my patients, it's really astounding the level of trauma that they have been exposed to. So maybe you could tell us about the different types of trauma there are, just so that we have a conceptual idea of that.
Definitely, there's an array of trauma. It can be childhood abuse, witnessing domestic violence. It can be being in a car accident can cause so much trauma. I've seen clients where they are so fearful of going into a car again. There's military sexual trauma. There's an array of trauma within the environments that we are in.
Now you are formerly you're basically were in the service, and so you saw this firsthand. You were with the Marine Corps first, and then with the Army National Guard. Do you think that there's been more of an awareness lately in the military about these type of issues, and what types of things are there in place to address the issue?
Yeah, definitely. I think it's being attended to more so now. There's training involved. So the military personnel has to go through annual training, or every 6 months they go through both suicide prevention and prevented sexual abuse or sexual harassment. So those are the two trainings that they have to go through. So I believe, I think I think the military is being more attentive to it, as they're seeing more cases of this spread throughout, and the impact on the military, the impact that it has. It does cause PTSD. So they want to be able to prevent this from happening.
Yeah, I'm sure the awareness goes a long way. Maybe years ago, these things weren't as recognized, and certainly there was an awareness of treatment modalities. Can you give us an idea of what are some of the symptoms that trauma survivors exhibit?
Yes, definitely. What I've seen a lot in clients is dissociation. So they sort of need to ground themselves, to use grounding exercises, because they're not in the present moment. There's also not feeling confident in yourself. So they are fearful of success. They're fearful of conversation, of being able to be assertive. And that's something that we work on as well within therapy, is assertiveness. There's also avoidance. So sometimes, we try to avoid any triggers. We try to avoid any places that can remind us of the abuse or remind us of the trauma. So that's one of the symptoms. But according, with treatment, it's something that we had to deal with head on.
Mm. Now, how would you differentiate between trauma therapy and regular talk therapy?
Hmm.
What are the differences?
Yeah, definitely. So trauma therapy, it's trauma focused. You're tackling head on. It's very structured. So it's 12 to 16 weeks. So for example, you have trauma focused CBT, which has, that's the umbrella for CPT, that cognitive processing therapy, and PE, but prolonged exposure. So it's way more structured, and it's a lot of psychoeducation. So my clients had told me they thought they were dealing with their trauma by talking about it and talk therapy, but once they start this trauma therapy, they can see a big difference, and they are so grateful for that treatment.
Mm. That's wonderful that they have that resource in place.
Mm-hmm.
Now, how
Yeah.
long do the effects of trauma last? Is that something that can resolve, or is that
Mm.
something that can last a lifetime?
Yeah, it can last a lifetime because so we try, as with trauma, we try to sort of like suppress any emotions naturally. That's how we cope as humans. But when we work on our healing process, we work on ourselves, and we go through that trauma focused therapy. We're able to, over time, that those emotions that are tied with the trauma, the trigger, and our stuck points, it alleviates. So it becomes less have that power and stronghold on us.
Mm. Could there be some events that re-trigger trauma, and what course does that take?
Mhm. Yeah. So it can be re-triggered, but the purpose of CBT and trauma focused CBT is to sort of being your own therapist. So it's using the tools that are involved, and when you're confronted with new triggers and you're feeling these emotions, you're reusing what you've been taught.
Mm.
Hmm.
So it's sort of like taking the tools out of the toolbox for when
Yes.
the
Yeah. Yeah.
situation presents itself.
Hmm.
Um,
Exactly.
and what impact can trauma have across generations? I'm thinking,
Hmm.
for example, specifically of Holocaust survivors. That
Hmm.
is probably as traumatizing as it can get, having survived through that. But then you hear about effects on future generations. What can you tell us about that?
Yeah, so it can be the vicarious trauma. So when an individual has their own trauma that they haven't sort of like tackled, and they haven't healed from, it can be manifested in within ourselves, and within um, projecting that energy, that negative energy, onto other people, and so they can feel that they have the symptoms with through vicarious trauma. They have the same symptoms as PTSD. It impacts them the same way. Um, so that's one way that it can impact generational.
Now, when you mention about
Mhm.
vicarious trauma, you don't necessarily have to be involved in the traumatic event for it to have an impact on you. So if I witness
No.
something violent or something that is life-threatening,
Hmm.
as someone, as a witness, I could actually exhibit the very same symptoms as if that violence was directed at me. Is that right?
Exactly. Exactly. And also, even within households. So, say for instance, like there's a lot of domestic violence. So either you're witnessing the domestic violence and you're feeling that you're taking on that vicarious trauma, or um, a husband went overseas and he comes back with PTSD, and there's all that anger and aggression built up. There's that the spouse is feeling that vicarious trauma with the husband. Um, yeah, so those are some of the examples.
I think it's true
Mhm.
that one of the natural responses sometimes is to avoid talking about it,
Mhm.
which can actually be a block to healing,
Exactly.
right?
Yeah, definitely a definite block, because we can get triggered unknowingly, get triggered by something, and then it resets us back to how we were feeling um, back then during the trauma. So instead of avoiding, it's highly encouraged, and part of the therapy is to tackle it head on versus avoiding. Avoiding is not going to help. And with the CPT, it's evidence based. It shows through research that it's very effective. It's highly effective.
Yeah, I think it's
Mhm.
also very informative to know about family history of trauma because
Mhm.
you it kind of sheds light, I think, on the reactions certain people have. Now, one of the things, ironically, I've decided I did this trauma prevention podcast, not knowing that there was a suicide in my own family because
Mm,
no one talked about it.
mhm.
But my sister, through the ancestry DNA, she found out that we had a relative in Australia.
I see.
And that person told us about my father actually had an aunt that committed suicide. My father wasn't even aware of it.
Mhm.
And what it was is that uh, the father of this young woman was planning an arranged marriage for her. And I guess there was a great deal of rigidity about this. And she probably felt she had no other recourse, but took a very, very tragic turn and set herself on fire. And that's how she
Mm,
suicide. So uh, obviously, she was traumatized by this challenge in her life, but I imagine the people that also had to deal with the aftermath of that
mhm.
suicide were also traumatized. And I think in those days, very
Mhm.
unfortunately, they didn't understand about therapy. So I think it could have played out so much differently, and it's unfortunate.
Well, I
But
can imagine how the family members felt, with either guilt or shame, um, with the aunt. Mhm.
yeah, it's really unfathomable that
Mhm.
it's existed. But it's just an example that here I am, and my father, who's in his 90s, had no
Mhm.
clue that this even happened.
Mm,
The family just chose to just keep it really secret, not talk about it. And
mm,
I think in doing that, when you don't talk to children about traumatizing events, they don't have a way to process it. And that in itself could be problematic because they understand things are going on, but they don't have a context for it.
mhm.
Yeah.
Exactly. There's many times where children are being told to suppress their emotions and not really show it. It's that saying, you have children, but they shouldn't be heard, right? They should be seen but not heard. It's a lot of when there's a lot of suppression, they learn that, and that's what they use in later days when they're older. Oh, well, then this is what needs to happen. We need to suppress our emotions. We shouldn't feel any emotions. But emotions should be sort of like, praise. We're humans. We're not robots, right?
Exactly.
So we're going to have emotions, and a lot of my clients, especially when they're young, they think anger is a bad emotion when it's not a bad emotion, right? It's bad when it's a reaction. It depends on what our reaction is to those emotions. So uh, teaching those the children that it helps them to uh, use their emotions in a healthy manner.
Yeah, no, absolutely. There's so many examples of that I've seen. I'm sure you've seen it too. When feelings are suppressed, they come out in indirect ways, and that's where it can become very dysfunctional.
Yes.
So, is there a relationship between, could there be a relationship between trauma and the emergence of substance and alcohol abuse?
Oh, definitely, definitely. It's a big thing where coping with the trauma, coping with those feelings of, either the guilt or shame. Sometimes people that go through trauma, they blame it on themselves, and they get some of the symptoms of PTSD is having those flashbacks, having those nightmares, and so in order to numb that pain, a lot of people will cope in a maladaptive way is to use drugs, use alcohol to sort of like numb all that pain. But in therapy, especially with the CBT, trauma focused CBT, we say in the very beginning, this is part of the contract that you're not going to use any substance. You're going to refrain from it throughout the sessions because it takes away from the sessions, take away from the treatment itself. But going back to how we cope, sometimes we cope with these maladaptive ways. It's sort of we trying to bring in all the good coping skills. Bring in, okay, this is why you're feeling this way. Giving them the psychoeducation on PTSD, letting them know, okay, what triggers you, what coping skills can you use, what are the stuck points, why are you feeling this way, why are you telling yourself this, and moving forward from that helps them realize, okay, I don't need the substance to cope anymore because I'm doing it on my own. It's empowering the client.
Yeah, and the substance could be thought of as a self-soothing type strategy. And that's just one. If you think about it, there could be so many others that are maladaptive. We can mention gambling. We can mention pornography.
Exactly. I've seen that a lot. I've seen it a lot recently. A lot of my clients have an addiction with pornography.
Yeah, and so do you think that support groups can be effective as well as an adjunct to individual therapy?
Yeah, so CBT can be run in group setting or individual. You can do both as well. But also the target, so say if there's a gambling addiction, that would be good to do as well in a group setting. Pornography addiction, any of those addictions can be done in a group setting. It's also drug and alcohol, NA, AA.
And from your experience, do you find that some people are just more resilient than others in dealing with trauma? And if that's the case, what factors can influence a person's resilience?
Yeah, that's a good question. Looking at those with PTSD from military service, they say in research that those who have the PTSD and not the acute stress disorder, so it's more than 6 months, they have prior trauma as well. So they have other childhood trauma. They have multiple of other traumas that have occurred before have caused them to be more to have more susceptibility to PTSD.
More vulnerability.
Yeah.
And with resilience, are there certain things that can influence it? For example, having a support system in place versus someone who's isolated. I see in the with incarcerated individuals, the ones that have support in their lives tend to fare better than the ones that have no support. And I imagine that that's probably across the board in society, that having several support systems or in place can really be a good buffer. Would you say that's true?
Oh, definitely. I would say that having one person, a positive mentor, a positive person in your life can change the your life trajectory. Definitely for sure.
Mm.
Hmm.
And can trauma have a long-lasting effect physically on the body?
Yes, yes. That's a good question too, because there's a book. It's called "The Body Keeps a Score" by Bessel van Kolk. And he it talks about that. It says that it causes trauma can cause different physical symptoms in our body. So we can it even mentions fibromyalgia and different ailments that we may go through. But everyone is different, and everyone will have a different impact on their body, on their psyche, on emotions and mentality. Um, so definitely, I highly recommend that book. He actually worked in the VA before. He started in the VA. That he started with military
Wow,
service people. Hmm.
interesting.
Hmm.
I worked for the Visiting Nurse Association for about
Hmm.
5 years. So I saw a host of medical issues,
Mm.
including cancer. And you can't say there's exactly a direct correlation, but usually when you go back and look at the histories of some of these people, you could say that maybe there was a direct impact. For example, someone who's a domestic abuse survivor, with
Hmm.
all the stress, the years of stress and the years of cortisol being in the body, that
Hmm.
could certainly have played a role, maybe not exclusively, maybe there could have been a genetic predisposition.
Hmm. Oh
And
yeah.
recently I was having lunch with a friend, and she was talking about one of the directors in her program was unfortunately diagnosed with cancer, brain cancer,
Mm.
and she died very unfortunately. And my friend mentioned that 4 years ago, her husband committed suicide.
Mm.
And I'm thinking, what a tragic thing that must have been for the woman and for her children. And again, you can't say with any certainty that that very tragic event was contributing to the cancer, the formation of the cancer. But for someone in the early 50s, it's doesn't
Too
take,
young.
yeah,
Hmm.
it's very young. It's very unfortunate. And how can a person know that they've been traumatized? What are there some symptoms that are more prevalent than others? For example, things like flashbacks or
Hmm.
nightmares, or maybe uncontrollable thoughts about the event.
Hmm. Yes, that's definitely if it's impacting their functioning ability, if it's impacting their sleep, their the way their appetite, um, and like you said, if they're having the flashbacks, um, and the nightmares as well, it's something to consider. They can talk to a therapist and be assessed for PTSD. It's using the PCL-5. That's the um, that's what we use to assess for trauma. Um, and there's an event that occurs, a traumatic event that occurs, and we have these emotions. We have they sort of talk about it as fight, flight, or freeze. So some people will freeze in traumatic events. Some people will fight in traumatic events or even flight, so they'll just leave the scene. So, going through that and then having it impact your functioning ability every day for the 6 months or more, or even less. If you go to 3 months and you're feeling depressed, you're isolating yourself. It's something to talk about with your prescriber, your primary care provider, and then they can send you over to a therapist.
There are certainly certain psychotropic medications that can help with those symptoms.
With depression and anxiety, definitely.
Yeah, and some specifically for PTSD, such as prazosin. But, of course, we always encourage people to seek out that consultation with a psychiatrist if the symptoms become overwhelming.
Exactly.
And in considering trauma, do you see more of a prevalence toward anxiety or depression or both?
I think both. I see a lot of both. And it's something that I do want to mention too, especially going through, if you want to become a clinician or you want to work with other trauma victims, I highly recommend that the person go through their own therapy first before going into the field, so that they can examine themselves, or even for the school, the master's school.
Yeah, it's certainly more effective to be aware of your own issues and your own triggers. And so with considering anxiety, are there different approaches that you might have versus someone who is depressed? Like, I'm thinking of anxiety, someone who's prone to panic attacks. I think of trauma really undermines the sense of safety that there is in the world. And now more than ever, when you hear about all these awful things that are happening, but panic attacks could feel very, very intense in a person. At what point would a person consider medication versus therapy in a scenario such as that?
So for trauma-focused CBT, we use that tool, the PCL5. If they don't have the PTSD or the criterion A, then we don't recommend the trauma-focused CBT. If it's more the anxiety and it's not PTSD itself, then focus more on coping skills for anxiety or coping skills for depression. So anxiety, it can be the coping skills strategies for that can be breathing techniques, the deep breathing. A lot of my clients that do have anxiety, we focus on deep breathing, and so that's just a count of 3. You inhale for a count of 3, you hold it for a count of 3, and then you exhale through your mouth for a count of 4. And then there's different meditations that we use, and it's daily practice. Is that more for say if you're feeling anxious at the moment, then use the meditation? No, it's a meditation that we use daily, and it's called Leads on a Stream, and that one's very good for get very good positive feedback from my clients. And so those are some of the coping strategies for anxiety.
As I mentioned before, having gone through something traumatic, it really undermines your sense of safety that there's in the world. And one rule of thumb I often give to people, because when you feel your safety is undermined, it often can usher in a thought process of waiting for the other shoe to drop and excessive worry. And what I often tell people is, when and if the event happens, then you worry about it, but not in advance.
Yeah,
Because if we
exactly.
stopped and thought about every possible thing that could go wrong, we would literally all be
Hmm.
paralyzed.
Yes,
So
exactly. That keeps us from moving forward if we're constantly thinking about the future and the what ifs, right? Also, part of that CBT, trauma focused CBT, it's talking about safety. There's a whole module on safety, and how we can move forward from it. And with the stuck points, the stuck points are these sort of thoughts that we get after trauma. So we had one way of thinking before, but then the trauma happens, and then so it sort of manipulates our thinking. And so we look at that, we process it, and come up with new way of thinking versus being in that stuck point.
the society has definitely become more and more complex.
Mm-hmm.
Yesterday, I actually went to see the movie The Sound of Freedom, and
Yes, I want
it
to
was
see that. I haven't seen it, but I know the
excellent,
story. Yes.
excellent movie. And
Mm-hmm.
when you think about that, parents have so much to be worried about
Yes.
with the
Yes.
prevalence of, these,
Sex
the,
traffickers.
yeah, sex
Mm-hmm.
traffickers. It's not just children. Sometimes it could be, teenagers and women. So
Mm-hmm.
many things to be anxious about. But I think, there's got to be that balance between worrying too much and then being too laid back and not worrying at all. I think there's a
Exactly.
middle balance there.
Mm-hmm. Yeah, so and also part of that trauma, it's that hypervigilance, right? So we become hypervigilant because, well, we don't want any other trauma to occur. So we're looking all around us. Or we can be aware of our surroundings. So that's having a balance. That's just being aware of what's going on around us, but not being on sort of like the level 8 or, the extreme.
Yeah, and
Hmm.
I think that it's always good to find that support. Now,
Hmm.
if you notice that there are signs of emotional detachment in a person,
Hmm.
but yet they're resistant to,
Mm,
or they're in denial that there's a problem, how would a person go
yeah,
about addressing that?
yeah, definitely. So like we therapists have that model. We meet the person where they're at that moment. So is working with the client, and we're giving them the education on what's out there, the treatment that's available, and giving them the psychoeducation on PTSD and trauma, and letting them make the decision. But it's a collaborative support, so we're working together, um, and not giving up on the client. So that's how I address it. If they're
Yeah,
not ready at that time, they're not ready, but we'll come back to it later, a
yeah.
later
All we
time.
could do is plant the seeds.
Exactly. And I've had clients like that, and they realize they do need it. They need to tackle it at this time.
Yeah, it's so important, the
Hmm.
sense of having control. And
Hmm.
it's not something that you could force,
Exactly.
because then
Exactly.
there's no motivation, no change would happen.
Hmm.
Um, um, and some people think that maybe talking about trauma can make
Hmm.
it worse. Um,
Yes.
uh, so, and how would you approach trauma in a child versus trauma in an adult? Are there different methods?
No, so it would be the trauma focused CBT. So just set more for adolescents or children when addressing it with them, but it's pretty much the same approach. So we have, uh, in the beginning, it's a psychoeducation, and it's building maybe more of a rapport in the beginning for uh, adolescents and the young ones. Um, but for adults, you can go straight with CBT. You can start with the trauma focus. You don't have to build a rapport with them.
With children,
Mhm.
is it common to use play therapy? I think that children, they don't have really the language to be able to put feelings always into words, but maybe comes out indirectly through the play therapy. And so, from your experience, is that an effective strategy?
It is. And, every child is different. It depends on their development stage as well, because you're going to have a 9-year-old that totally understands, um, what an adult can understand for trauma focused CBT. So it depends on their development.
Yeah. Um, any other thoughts on trauma that you can this with?
Just I just highly recommend, like I had mentioned before, I just want to, I guess, remind others that are listening that, if you're wanting to focus on trauma therapy, or become a clinician or even social work, or mental health, that I would say to go to therapy yourself and, make sure that you are okay and ready to take on that field and move forward and help others, because we're not able to help others if we need to help ourselves first.
No, absolutely.
Yeah,
Yeah.
it's like trying to pour, into something that's already overflowing. Yeah, that's what they say. So I highly recommend that.
And that's where I think
Hmm.
self-care really
Hmm.
comes in, both for people who are traumatized and caregivers,
Hmm.
because as human beings, we could get depleted very quickly, and especially after a traumatizing event. Well, we used to have a psychiatrist in our agency a long time ago, and he had a really cool way of thinking about life. He said, life is like surfboarding. Sometimes you get little waves, sometimes you get
Hmm.
big waves, but the goal is always the same, and that's to stay afloat.
Oh, great.
And there's so many in
That's
life,
good.
you just never know what's going to come at you next. So, if
Hmm.
you are going through a stressful time, or there has been some trauma, which is bound to happen in the
Hmm.
course of human existence,
Hmm.
exercising that self-care is so vital. And part of that self-care is knowing that it's okay to reach out for help, and even
Yes.
to share with a support system the things that you're going through.
Hmm.
And this is Suicide Prevention Podcast. So many people, when they're going through things, just tend to just not want to burden other people.
Hmm. Hmm.
Um, when in reality, people are so willing to give up their time and resources. So that mindset of wanting to just handle things on one's own is not
Hmm.
necessarily, it doesn't jive with the reality of that there is help available, and through
Hmm.
support groups, through therapists, through family,
Hmm.
friends, there's always, it's not the case that a person has to handle things on their own.
Hmm. Especially the hotline, right? There's a 988 that um, someone can call as well.
Yeah, and I think
Hmm.
that I've seen over time in my 35 years of clinical practice that human beings are really capable of amazing things, even
Hmm.
when they are at the real depths of depression.
Hmm.
There's this life force in everyone, and sometimes but once it gets unleashed, beautiful things are capable of happening. And
Hmm.
just keeping that sense of optimism for the future is so, so important. Hope is so, so important.
Yes. Yes. And I hope that that's what that we get across, is that there is hope. So even though they may going through this, they had a traumatic event and they are feeling very depressed, that to know that there is hope. there for, reach out to someone.
And I think also
Mhm.
where children are involved, just giving them permission to
Mhm.
express their feelings. And
Yes.
so important, not being secretive about things and just being
Mhm.
natural in one's approach. Well, I
Mhm.
want to extend a very big thank you for
Thank
thank you
you.
for imparting the wisdom.
Yes, thank you for having me. Thank you for inviting me.
It's a pleasure. Thank you.
Thanks. Okay, bye.